Welcome back to the
I have osteoporosis
podcast. Today we will be giving an overview of the skeletal system and how osteoporosis disrupts it with your hosts Tracy
and Kimberly. Before we start talking about osteoporosis, let's take a look at our Bones Day forecast from Noodle the Pug. It looks like today is a no bones day, sadly.
So what is osteoporosis?
Osteoporosis is when bones become weak and brittle, which causes fractures and broken bones.
What organ system does osteoporosis affect?
That is a good question. Skeletal system. The skeletal system is your body's central framework. It consists of bones and connective tissues. Connective tissue includes ligaments, tendons, and cartilage. The skeleton helps store vitamin D and calcium, produces blood cells, allows movement, and helps protect and support the organs.
Well, that reminds me. The calcium storage is affected by osteoporosis.
Oh, really? I did not know that.
Yes, really. The skeleton maintains homeostasis by regulating mineral storage. The bones store minerals as well as release them into the blood as needed.
For example, the body will take in vitamin D from the cell or supplements. Then it is converted to calcitriol in the liver by hydroxylation. The calcitriol is then converted to calcitriol in the kidneys, also by hydroxylation. This final product of calcitriol is the active form of vitamin D your body uses. When your body is in vitamin D deficiency, your doctor may recommend taking vitamin D pills to help keep your body at homeostasis.
Did you know your bones rebuild throughout life? Osteoclasts destroy old bone tissue and osteoblasts rebuild bone tissue. Remodeling heals injured bones and renews osseous tissue before deterioration occurs. It is important that all of these things function correctly to ensure your bones are healthy. Otherwise, you'll have many complications in your life.
So you're telling me an imbalance between bone resorption and formation leads to osteoporosis?
Yes, that is exactly what I'm telling you. Now let's hear what kinds of these. Take it away, Eki.
Thank you, Tracy. I am so excited to be on this episode. Let me tell you all the lifestyle choices that can make you more likely to get this disease. The chance of getting osteoporosis can be lessened by keeping a healthy diet. It can all start from prenatal development because if the mom has a healthy diet, there will be a high chance the offspring will have good bones. But if the mom has a high-fat diet and consumes alcohol, it can lead to a lower bone mass with high rates of bone fracture. Another diet pattern that can improve bone health is filled with dairy products, fruit, and whole grains. For those ladies out there, there's a chance that having low to moderate alcohol intake will slightly protect your bones. On the flip side, excessive amounts of alcohol should be avoided. A study connects recurring bone fractures to low amounts of dairy intake, physical activity with a higher BMI, and carbonated beverage intake. Also connected to low bone mass density is high carbonated beverage intake. According to the U.S. Department of Health and Human Services, kids doing some sort of physical activity at least 60 minutes a day will lead to healthier bones as they grow up. To go with that, it seems only half of the youth is completing the recommended amount of physical activity per day. Adults should be promoting a healthy lifestyle and push their kids to consume healthy foods and complete the recommended amount of daily exercise that would lead to healthier bones. It seems that's all I have for you today.
Thank you, Eki. We will take it over to Kenzie to talk about the causes and symptoms of osteoporosis. But first, a word from our sponsor.
Do you suffer from back pain caused by a fracture, loss of height over time, stooped posture, and brittle bones? Have you symptom checking WebMD? Well, you may be suffering from osteoporosis. I have just the thing for you. Vitamin D shots. These build stronger bones and improve calcium absorption. You can find them at any gas station or grocery store near you. One quick drink, and you'll be on your way to a stronger and happier skeletal system. Side effects may include constipation, weight loss, fever, vomiting, weakness, increase in thirst, decreased sex drive, dizziness, dry mouth, poor appetite, irregular heart rate, edema, kidney damage, and mood changes.
Thank you, Kim. I am beyond ecstatic to talk about the causes and symptoms of osteoporosis. New bones are being made and old bones are being broken down constantly, meaning that our bones are in a constant state of renewal. As bones age, bone mass is lost faster than it is made. Age 30 is the peak of bone mass, but after the age of 20, it begins to slow. Some unchangeable risks that cause osteoporosis are your sex, age, race, family history, and body frame structure. According to the MayoClinic.org, women are more prone to osteoporosis than men due to thinner bones and the decrease of estrogen hormone during menopause. Other risks are hormones such as sex hormones, thyroid problems, and other glands. Medication can also increase one's risks. Some medications to be aware of are steroids, seizure medication, and immunosuppressive drugs. Diet is also a factor such as eating disorders, gastrointestinal surgery, and low calcium intake, which contributes to diminishing bone density and increased risks of fractures. Lifestyle choices can make a huge impact on this bone condition. These choices would include a sedentary lifestyle, excessive alcohol consumption, and tobacco use. Osteoporosis does not have symptoms early on, in the early stages of bone loss. It is also known as the silent thief. When experiencing bone loss, some people may have symptoms that include back pain caused by a fracture, loss of height over time, stooped posture, and bones that break more easily than usual.
Thank you, Kenzie. Now let's head over to our experts on the prevention and treatment of osteoporosis and Tori.
Thank you for inviting us today, Tracy and Kim. We're very excited to be here. By the time these symptoms have appeared, oftentimes it is too late. Osteoporosis' irreversible quality ensures this. Luckily, there are ways to lower the risks of osteoporosis. Prevention of osteoporosis begins with the accountability of the patient. Preventative screening and a family history discussion with a medical provider will help avoid early onset osteoporosis.
Another way to stave off osteoporosis is to include a healthy and conscientious diet. Healthy options, leafy greens, and vegetables, foods rich in omega-3 fatty acids, and calcium-enriched foods. Just like our friend Eki said, along with a healthy diet, there are foods that ought to be avoided, such as alcohol and processed foods that contain hydrogenated fats.
That's right, Tori. Not only is diet a great start, but the accompaniment of exercise will increase the likelihood of avoiding osteoporosis. Eki also mentioned physical activity. Specifically, there are 2 exercise practices that aid in bone density maintenance. The first one involves engaging all muscle groups by incorporating aerobic or yoga twice a week into an exercise regimen. The second type of exercise involves muscle strengthening exercises with lifting weights and targeting the major muscle groups. A provider may recommend low or high